Mental health is a vital part of our overall health. It is not separate from our physical well-being. Good mental health is the foundation that allows us to live full and meaningful lives. It affects how we think, how we feel, and how we act each day. It helps us handle stress, build relationships with other people, and make healthy choices for ourselves and our families. When our minds are healthy, we are better able to work, to learn new things, and to contribute to our communities. We can face challenges with more strength and find joy in our daily experiences. Without good mental health, it is very difficult to have good physical health or a good quality of life. The World Health Organization has reported that 1 in every 8 people globally lives with a mental health condition. This is a very large number. In almost every family, in every workplace, and in every community, someone is facing these challenges. What does it mean to integrate mental health care? Integration is the simple but powerful idea that mental health is not a separate, specialized service for only a few. Instead, it is a fundamental part of all healthcare, for all people. It means that when you visit your family doctor or a local nurse, they are also prepared to ask about and help with your emotional well-being. It is about moving mental health support out of isolated psychiatric hospitals and into the places where people live their daily lives. This includes primary care clinics, community centers, schools. Integration means that getting help for anxiety should be as routine as getting a blood pressure check. There is strong proof that this integrated model works. The first major benefit is reach. Primary care visits are trusted opportunities to screen for depression and anxiety. People often feel more comfortable with a familiar doctor or nurse, increasing access, especially in rural and underserved areas. A second proof point is effectiveness. Brief counseling and medication can lead to significant improvements without long waits or travel. This is why integrating mental health into our primary care systems is so urgent. When people need help for a fever or a broken bone, they know where to go. They can visit a local clinic or a family doctor. We need to make it just as easy and normal to get help for feeling sad, worried, or overwhelmed. Waiting for problems to become severe is not a good strategy. It leads to more suffering and higher costs for everyone. By making mental health care a standard part of regular health services, we can help people sooner, more effectively, and with more compassion. Studies from many countries show that when support is provided in community settings, people get better. Early intervention prevents mild problems from becoming severe disabilities. It helps people stay employed, keeps children in school, and strengthens families. This is about promoting well-being for all. By building these systems, we invest in health, happiness, and prosperity. It is a practical and hopeful path forward. Building an effective framework can follow a clear pathway. The first and most crucial step is to train primary care workers, doctors, nurses, and community health workers. Use simple screening tools and teach basic counseling skills for immediate support. Establish clear care pathways. First, screen. If needed, offer brief counseling. If severe or no improvement, refer to a specialist. A simple written plan enables consistent care and easier follow-up over time. Build strong teamwork. No single person can do this alone. Create referral networks and regular case meetings while protecting privacy. This network ensures easy connection to the right service and creates a safety net. Use community spaces, support groups, workshops for parents and teachers. Local leaders and teachers can be powerful allies. Bringing support into familiar settings makes help accessible and less intimidating. Measure success with 2 indicators: the number screened each month and the number who receive help, brief counseling or referral. Track, learn, and improve over time. Section 5. Shining a light on the shadows. Stigma is one of the biggest barriers preventing people from seeking help. It is the fear of being judged. It is the fear of being misunderstood. It is the fear of being treated unfairly. Change the language we use. Instead of clinical or scary words, use everyday language. Someone is going through a tough time. They are feeling very worried. Share real stories of recovery. When respected individuals speak, it has a profound impact. Local leaders and health workers speaking up show people they are not alone and that treatment works. When leaders speak openly, their endorsement gives others permission to think and talk differently. Organize campaigns. share positive stories, and model compassion. Public support reframes help-seeking as strength. Clinics must guarantee confidentiality and privacy, greeting everyone warmly. A safe clinic breaks stigma and invites openness. Section 6. Activating the system. Primary care clinics are the natural hub, trusted and accessible. Make a brief mental health check a routine part of every visit, like temperature or blood pressure. Ask, over the past 2 weeks, have you been feeling down, depressed, or hopeless? Normalize the conversation. Train nurses and medical assistants to deliver brief, supportive counseling for stress in a few short sessions. Activate schools. Train teachers to spot early distress, withdrawal, acting out, struggling academically. Offer a dedicated counselor and supervised peer groups. Use local venues for open group sessions, stress reduction workshops, and new parent support groups. Leverage community health workers to connect at home, provide basic support, and link families to resources. Use simple tech, texts, calls, basic apps to extend care, not replace it. A human call often matters most. One of the biggest challenges is the worldwide shortage of specialists, psychiatrists, and psychologists. The solution? Task sharing, shifting some specialist tasks to trained health workers. Not turning everyone into specialists, but empowering more people to deliver care within their training. Community health workers are ideal, trusted, culturally attuned. Train them for screening and basic psychological interventions. Teach behavioral activation, help people become more active and re-engage with life. Nurses and primary care doctors can manage common conditions, provide brief counseling, and prescribe simple medications when appropriate. Ongoing supervision is key. Specialists support teams via regular case reviews. A tiered system, CHWs screen and support. Primary care manages most. Specialists focus on complex cases, training, and supervision. A people power approach that is smart, efficient, and dignified. Right care, right time. Real-world examples show these principles in action. In parts of India, lay community health workers delivered simple, evidence-based talking therapy for depression, yielding remarkable improvements over usual care. In Zimbabwe, trained grandmothers provide problem-solving therapy on benches outside clinics, reducing depression and anxiety with culturally rooted support. In high-income settings, collaborative care uses a nurse or social worker care manager with psychiatric consultation, improving outcomes and satisfaction. Common themes: start small with pilots, use existing resources like CHWs and nurses, provide practical training, tailor to culture and language, show success with clear data, and highlight real improvements in well-being. With creativity, commitment, and a focus on community, we can build systems that provide mental health care for all. Section 9. A hopeful horizon. We now know how to deliver mental health care effectively and affordably. Not through more large, isolated hospitals, but by weaving mental health into communities and primary care. The evidence is clear. The tools are available. We have a blueprint. Care for the mind should be normal, accessible, and dignified. No one should suffer in silence. This is a collective responsibility, not only ministers or doctors. Start conversations with friends, families, and colleagues. Encourage local leaders to prioritize mental health. Support organizations training CHWs and delivering care on the ground. Challenges are real, but start with pilots that show quick wins. Empower local champions. Show it works, helps people, and is a smart investment. Build momentum through many small, determined steps. Embrace this hopeful horizon. Support integration in every primary care clinic and every community. Treat mental health as a fundamental human right. Work together, neighbors, professionals, leaders, and as a global community. The time to act is now. Let's get to work. Mental health is a vital part of our overall health. It is not separate from our physical well-being. Good mental health is the foundation that allows us to live full and meaningful lives. It affects how we think, how we feel, and how we act each day. It helps us handle stress, build relationships with other people, and make healthy choices for ourselves and our families. When our minds are healthy, we are better able to work, to learn new things, and to contribute to our communities. We can face challenges with more strength and find joy in our daily experiences. Without good mental health, it is very difficult to have good physical health or a good quality of life. The World Health Organization has reported that 1 in every 8 people globally lives with a mental health condition. This is a very large number. In almost every family, in every workplace, and in every community, someone is facing these challenges. What does it mean to integrate mental health care? Integration is the simple but powerful idea that mental health is not a separate, specialized service for only a few. Instead, it is a fundamental part of all healthcare, for all people. It means that when you visit your family doctor or a local nurse, they are also prepared to ask about and help with your emotional well-being. It is about moving mental health support out of isolated psychiatric hospitals and into the places where people live their daily lives. This includes primary care clinics, community centers, schools. Integration means that getting help for anxiety should be as routine as getting a blood pressure check. There is strong proof that this integrated model works. The first major benefit is reach. Primary care visits are trusted opportunities to screen for depression and anxiety. People often feel more comfortable with a familiar doctor or nurse, increasing access, especially in rural and underserved areas. A second proof point is effectiveness. Brief counseling and medication can lead to significant improvements without long waits or travel. This is why integrating mental health into our primary care systems is so urgent. When people need help for a fever or a broken bone, they know where to go. They can visit a local clinic or a family doctor. We need to make it just as easy and normal to get help for feeling sad, worried, or overwhelmed. Waiting for problems to become severe is not a good strategy. It leads to more suffering and higher costs for everyone. By making mental health care a standard part of regular health services, we can help people sooner, more effectively, and with more compassion. Studies from many countries show that when support is provided in community settings, people get better. Early intervention prevents mild problems from becoming severe disabilities. It helps people stay employed, keeps children in school, and strengthens families. This is about promoting well-being for all. By building these systems, we invest in health, happiness, and prosperity. It is a practical and hopeful path forward. Building an effective framework can follow a clear pathway. The first and most crucial step is to train primary care workers, doctors, nurses, and community health workers. Use simple screening tools and teach basic counseling skills for immediate support. Establish clear care pathways. First, screen. If needed, offer brief counseling. If severe or no improvement, refer to a specialist. A simple written plan enables consistent care and easier follow-up over time. Build strong teamwork. No single person can do this alone. Create referral networks and regular case meetings while protecting privacy. This network ensures easy connection to the right service and creates a safety net. Use community spaces, support groups, workshops for parents and teachers. Local leaders and teachers can be powerful allies. Bringing support into familiar settings makes help accessible and less intimidating. Measure success with 2 indicators: the number screened each month and the number who receive help, brief counseling or referral. Track, learn, and improve over time. Section 5. Shining a light on the shadows. Stigma is one of the biggest barriers preventing people from seeking help. It is the fear of being judged. It is the fear of being misunderstood. It is the fear of being treated unfairly. Change the language we use. Instead of clinical or scary words, use everyday language. Someone is going through a tough time. They are feeling very worried. Share real stories of recovery. When respected individuals speak, it has a profound impact. Local leaders and health workers speaking up show people they are not alone and that treatment works. When leaders speak openly, their endorsement gives others permission to think and talk differently. Organize campaigns, share positive stories, and model compassion. Public support reframes help-seeking as strength. Clinics must guarantee confidentiality and privacy, greeting everyone warmly. A safe clinic breaks stigma and invites openness. Section 6. Activating the system. Primary care clinics are the natural hub, trusted and accessible. Make a brief mental health check a routine part of every visit, like temperature or blood pressure. Ask, over the past 2 weeks, have you been feeling down, depressed, or hopeless? Normalize the conversation. Train nurses and medical assistants to deliver brief, supportive counseling for stress in a few short sessions. Activate schools. Train teachers to spot early distress, withdrawal, acting out, struggling academically. Offer a dedicated counselor and supervised peer groups. Use local venues for open group sessions, stress reduction workshops, and new parent support groups. Leverage community health workers to connect at home, provide basic support, and link families to resources. Use simple tech, texts, calls, basic apps to extend care, not replace it. A human call often matters most. One of the biggest challenges is the worldwide shortage of specialists, psychiatrists, and psychologists. The solution? Task sharing, shifting some specialist tasks to trained health workers. Not turning everyone into specialists, but empowering more people to deliver care within their training. Community health workers are ideal, trusted, culturally attuned. Train them for screening and basic psychological interventions. Teach behavioral activation. Help people become more active and re-engage with life. Nurses and primary care doctors can manage common conditions, provide brief counseling, and prescribe simple medications when appropriate. Ongoing supervision is key. Specialists support teams via regular case reviews. A tiered system. CHWs screen and support. Primary care manages most. Specialists focus on complex cases, training, and supervision. A people power approach that is smart, efficient, and dignified. Right care, right time. Real-world examples show these principles in action. In parts of India, lay community health workers delivered simple, evidence-based talking therapy for depression, yielding remarkable improvements over usual care. In Zimbabwe, trained grandmothers provide problem-solving therapy on benches outside clinics, reducing depression and anxiety with culturally rooted support. In high-income settings, collaborative care uses a nurse or social worker care manager with psychiatric consultation, improving outcomes and satisfaction. Common themes: start small with pilots, use existing resources like CHWs and nurses, provide practical training, tailor to culture and language, show success with clear data, and highlight real improvements in well-being. With creativity, commitment, and a focus on community, we can build systems that provide mental health care for all. Section 9. A hopeful horizon. We now know how to deliver mental health care effectively and affordably. Not through more large, isolated hospitals, but by weaving mental health into communities and primary care. The evidence is clear. The tools are available. We have a blueprint. Care for the mind should be normal, accessible, and dignified. No one should suffer in silence. This is a collective responsibility, not only ministers or doctors. Start conversations with friends, families, and colleagues. Encourage local leaders to prioritize mental health. Support organizations training CHWs and delivering care on the ground. Challenges are real, but start with pilots that show quick wins. Empower local champions. Show it works, helps people, and is a smart investment. Build momentum through many small, determined steps. Embrace this hopeful horizon. Support integration in every primary care clinic and every community. Treat mental health as a fundamental human right. Work together, neighbors, professionals, leaders, and as a global community. The time to act is now. Let's get to work.
Many people believe a powerful and persistent myth about healthcare, that it is a scarce commodity, and high-quality care must, by its very nature, be reserved for the wealthy. This story tells us that trying to provide good health services for everyone is a fool's errand, an unaffordable dream that will inevitably lead to rampant waste, interminable waiting lines, a decline in quality for all. It is a narrative rooted in fear, one that suggests the only way for some to have excellent care is for many others to go without. This deeply ingrained belief paints a picture of a zero-sum game, where one person's health security must come at the expense of another's. Health is far more than the absence of sickness. It is the essential foundation upon which thriving societies are built. We often focus narrowly on treating diseases, on the dramatic moments in an emergency room, or an operating theater. But its true impact is broader and more quietly pervasive. Good health enables a child to attend school, to concentrate on her lessons, and to develop into a capable adult. Health allows a worker to be productive and earn a stable income, supporting his family without fear that a minor injury derails his future. When many lack basic services, consequences ripple outward, affecting everyone. Preventable diseases spread more easily. Small, treatable problems are left to fester, becoming complex emergencies that are far more expensive. This strains the health system and drains productivity. Universal access is a strategic investment in human capital and social cohesion. Security reduces anxiety and enables people to take risks and build the future. The first effective model brings healthcare to where people live. This approach is called community-led primary care. It de-emphasizes large centralized hospitals, favoring a distributed network of local clinics and health workers. The focus is overwhelmingly on prevention and health education. They manage common, everyday health issues. Local posts become the first point of contact. Prenatal checkups, childhood vaccinations, diabetes care, hypertension management, staffed by nurses and mid-level providers alongside trained local residents. The model reorients care from reactive to proactive. Embedding services removes barriers of distance, cost, and time off work. CHWs visit homes, identify at-risk individuals, and support adherence. Steady engagement catches problems early, reducing expensive emergency interventions and hospitalizations, maintaining health cost-effectively. Rwanda offers a compelling example. After 1994, Rwanda rebuilt around community health workers. Over 45,000 workers, elected by their villages, serve neighbors. They treat malaria, diarrhea, and pneumonia. They screen for malnutrition and accompany pregnant women for skilled delivery. Child mortality fell by over 70% in less than 2 decades. A second powerful model is a single, government-managed public insurance plan. It is usually funded through taxes or mandatory Social Security contributions. This is often called a single-payer model. The government acts as the primary financier. It need not own hospitals or employ doctors. Care can be delivered by a mix of public and private providers. The government pays the bills, simplifying administration. Consolidated purchasing power negotiates prices for drugs, devices, and services. The core benefit is universal access and administrative simplicity. One large risk pool spreads costs across young and old, healthy and sick. No individual faces a crushing medical bill alone. One payer cuts overhead, providers escape insurer mazes. Thailand provides a real-world example. In 2002, it launched the Universal Coverage Scheme, funded primarily through general taxation. Comprehensive benefits with very low or no co-payments. Care is accessed with a national ID card. Households pushed into poverty by medical expenses dropped by nearly 2/3. The challenge, budgets versus demand for new, expensive technologies. Coverage choices are politically contentious. Too low reimbursement risks underfunded hospitals, longer waits, and talent flight, requiring careful management and strong political will. Model 3, mixed public-private systems with strong safety nets. It is a hybrid, a carefully regulated blend. The landscape is a mosaic of providers and insurers. Mandatory public insurance, often via payroll taxes split between employers and employees, covers the majority. Private insurance supplements for additional benefits or faster access. A strong safety net ensures no one falls through the cracks, Government sets rules, mandates essential benefits, and bans denial for pre-existing conditions. Subsidies help low-income people afford premiums. Public options serve the unemployed or those outside employment-based schemes. Germany is a classic archetype. Competing non-profit sickness funds, required for workers. Privately managed, tightly regulated on benefits and pricing. The state ensures coverage beyond the workforce. High quality with relatively short waiting times. The challenge is avoiding a two-tier system. Regulators must enforce standards and sustain public sector staffing and safety nets. One persistent argument is that universal health care is too expensive. The cost myth paints bloated budgets and runaway spending, an unsustainable burden on taxpayers. But fragmented markets hide higher costs, administrative waste, price gouging, and productivity loss. Many universal systems spend less per person with better or comparable outcomes. Design, not destiny, drives value. Centralized purchasing lowers prices for drugs and equipment. Standardized procedures cut bureaucracy. Primary and preventive care avert costly ER visits and hospitalizations. Shift from paying for sickness to investing in health. Another myth claims universal coverage means declining quality. Evidence does not support that. Quality in public, private, or mixed systems depends on clear standards, adequate funding, rigorous training, and continuous improvement. Many top-performing innovative systems are universal. They keep quality with strong regulation and intelligent incentives. National standards and outcomes tracking drive better care. The best universal systems are dynamic, data-driven, and constantly improving. Successful systems share foundational pillars. First, unwavering commitment to primary care. Neglect the front lines, and the system plays catch-up. Robust primary care manages most needs efficiently and navigates referrals wisely. Second, clear, intelligent regulation. Set fair prices, enforce quality and safety, and mandate equitable access. Strong oversight levels the field and protects patients. Third, stable, equitable financing. Reliable public funding based on ability to pay enables resilience and planning. Finally, include the community voice. Care with people, not to people. Formal feedback, community governance, and local empowerment build trust. Ownership drives appropriate use and public health participation. Engagement makes systems responsive and effective. Beyond charts and debates, human stories measure system success. A newborn with fever, a 24-hour nurse hotline guides care and books a morning clinic visit. The child is seen in time. Stress and costs are contained. A worker's diagnosis is not a financial death sentence. Visits, medicines, and education are covered. He stays productive and present at home. An elder receives surgery by medical need, not wealth. Operation, stay, and rehab are covered. Mobility, dignity, and connection restored. These quiet triumphs happen daily where health for all is a lived commitment. Reform must center the well-being of people. We began by confronting the myth that quality care is an exclusive good. Evidence shows nations, by design, deliver fair, effective, affordable care to all. From Rwanda to Thailand to Germany, success is engineered, not ideological. Common sense principles: prevent first, regulate smartly, finance fairly, and listen to communities. These are pragmatic choices, tested and proven. The greatest obstacle is not knowledge, but will. A person's health must not be set by bank balance. Health for every human is achievable. Let us find the wisdom and courage to build on what works.
Dawn of time, we have shared a common ancestry, Adam and Eve. This shared bond is the foundation of our humanity, reminding us that beneath our differences we are one family. In a world that often seems divided, Peaceism emerges as a beacon of hope. We believe in the power of unity, in the strength of coming together to build a future where peace is not just a dream, but a reality. Our mission is simple yet profound: to foster understanding, compassion, and cooperation among all people. Through education, dialogue, and community initiatives, we strive to break down the barriers that separate us and to create a world where every individual feels valued and heard. Join us on this journey. Stand with Peaceism and be part of a movement that transcends borders and beliefs. Together, we can turn the page of history to a chapter filled with love, respect, and enduring peace. Because at the end of the day, we are all descendants of Adam and Eve. Let's honor that legacy by building a peaceful future for all.
Every year, a staggering number of people are forced into extreme poverty. They are not pushed there by war or by famine, but by the simple act of trying to stay healthy. Almost 100 million people fall below the poverty line annually because they have to pay for health care. This is not just a statistic, it is a global crisis unfolding in quiet desperation across countless villages and cities. It represents a profound moral failure in our interconnected world. For these millions, a diagnosis is more than a health concern. It is a financial catastrophe waiting to happen, a trapdoor that can swallow entire families, leaving them with nothing. This devastating reality demonstrates the cruel intersection of health and wealth. When a family member gets sick, the costs of treatment can become an unbearable burden. In a small, sun-drenched village, far from any major city, a young mother named Amina woke to the sound of her child's labored breathing. The boy's fever had been rising for 2 days, and a deep, rattling cough had settled in his chest. Fear clutched at her heart. The local clinic, a small concrete building staffed by a single nurse, was a long walk away. She knew it would demand a fee for consultation and for any medicine she might need. The few coins she had saved were not nearly enough to cover the cost of care, a fact that weighed on her as heavily as her son's illness. With no other choice, Amina made a decision that countless parents in her position are forced to make. She sold the family's 2 goats, their primary source of milk and a vital asset. The money from the sale was just enough to pay for the clinic visit and the initial round of medicine.
"I had to do it," she would later say, her voice quiet but firm. What else could a mother do when her child cannot breathe?
Her words echo the silent desperation of millions who must sacrifice their future security for immediate survival, hoping that one desperate gamble will be enough. But the medicine did not work as quickly as they had hoped. Her son's condition worsened, and the clinic nurse said he needed stronger antibiotics, which were more expensive. The family's small savings were already gone. With a heavy heart, Amina and her husband sold a small parcel of their farmland, a piece of earth that had been in their family for generations. They used the money to buy the new drugs, praying this would finally bring healing. For weeks, the family ate less, their meals shrinking as their resources vanished. The loss of their land and livestock was a devastating blow. Amina's story is not an isolated tragedy. It is a common narrative repeated daily across the globe, from the rural plains of Africa to the mountain villages of Asia and the urban slums of Latin America. The primary driver of this crisis is a concept known as out-of-pocket spending. This is when people must pay for health services directly from their own funds at the moment they need care, with no help from government subsidies or insurance. In wealthy, high-income nations, these direct payments make up a relatively small portion of total health spending. National health systems, employer-sponsored insurance, other social protection schemes. This creates a crucial buffer that protects individuals and families from the full financial impact of getting sick. Ensuring a medical emergency does not automatically become a financial one. In many low- and middle-income countries, however, the situation is tragically reversed. Out-of-pocket payments represent a much larger share of health financing, sometimes accounting for over half of all spending in the sector. Governments may lack the tax base or the political will to fund a comprehensive public health system, and formal insurance is often inaccessible, so the burden falls on individuals. See a doctor, get a lab test, buy medicine. They are often presented with a bill that must be paid on the spot. This reliance on direct payments creates a formidable barrier to care. For those living on just a few dollars a day, even a small fee for a consultation can be prohibitively expensive. Consequently, many people delay or forgo seeking medical help altogether, allowing preventable or treatable conditions to become more severe and costly. A simple infection that could have been cured with a cheap course of antibiotics can escalate into a life-threatening illness. This system effectively rations healthcare based on the ability to pay, leaving the poorest and sickest with the least access to services. The consequences are devastating for both health and economic well-being. Do you sell the land that feeds your family to pay for your child's medicine? Do you pull your children from school to cover the cost of a hospital stay? The gap between those who have access to quality health care and those who do not is not shrinking. In many ways, it is widening. This growing divide is fueled by a constellation of economic forces, political forces, social forces. High-income countries spend, on average, thousands of dollars per person on health each year. Advanced hospitals, well-trained medical staff, comprehensive health services. In contrast, many low-income nations can only afford to spend a few dozen dollars per person, leaving their health systems chronically underfunded, understaffed, and ill-equipped. External debt, structural adjustment policies, and trade agreements pressure budgets away from health. Brain drain leaves shortages of doctors, nurses, and essential health workers. Rapid innovation, new technologies, diagnostics, breakthrough medicines brings hope, but at exorbitant prices. When a family faces a major health expense, the immediate cost is only the beginning of their financial turmoil. The true impact is a devastating ripple effect that can destabilize every aspect of their lives for years to come. A single surgery or a prolonged illness can easily cost more than a family's entire annual income. To cover such an expense, the first assets to be sold are often those that generate income: livestock, farming equipment, a small shop's inventory. This immediately cripples the family's ability to earn a living. One of the most tragic consequences is the removal of children from school. Malnutrition and untreated illness create a vicious feedback loop of sickness and destitution. High-interest loans can spiral into debt bondage, all because someone got sick. World Health Organization, World Bank. They track this phenomenon, catastrophic health expenditure, and estimate nearly 100 million people pushed into extreme poverty each year. The fact that millions are impoverished by healthcare costs is not an accident. It is the direct result of systemic failures in how we finance and deliver health services. A primary cause is insufficient public funding for health in low and middle-income countries. Budgets often prioritize defense or infrastructure instead. Chronic underinvestment means too few clinics, too few salaried health workers, and not enough essential medicines. With gaps in public provision, people rely on fragmented, often unregulated private care operating for profit. Fees for every service, often unaffordable for the average person. Market-based healthcare excludes the poor. Ability to pay, not medical need, decides who gets care. Past policies introduced user fees and cut public spending, sharply reducing access for the poor. Patents keep generics off the market, setting high prices that keep life-saving drugs out of reach. And where political will is weak, the marginalized, without voice or power, are overlooked, and the system continues to fail those who need it most. Despite the scale of the problem, proven and powerful solutions exist. The single most effective strategy to protect people from catastrophic health costs is the implementation of universal health coverage. Everyone should have access to the quality health services they need without suffering financial hardship as a result. Move away from out-of-pocket at the point of care toward prepayment and risk pooling through taxes or social health insurance. When costs are shared across the population, no single family bears the full burden. Thailand's 30 Baht scheme provided comprehensive care for a nominal co-payment, reducing out-of-pocket spending and improving access. Rwanda's community-based schemes helped drive a steep decline in child mortality. UHC requires political commitment, increased public financing, reliable medicines, and a paid, trained workforce. A healthy population is more productive, and protecting families strengthens the economy. De-link healthcare from personal wealth and break the cycle of sickness and poverty. While national policies like universal health coverage are essential, some of the most impactful solutions are being pioneered at the local level, on the front lines of care. Community health workers, often women, receive basic medical training to provide essential services where people live, bridging formal systems and remote populations. They manage childhood illness, provide vaccines, screen for malnutrition, and ensure prenatal care. Trusted, local, and culturally fluent, they reach the most vulnerable households. Mobile phones enable telemedicine and mHealth at low cost. Remote consults save time and money. Portable diagnostics speed up treatment at the doorstep. Community-based health insurance pools risk and builds trust. Combine CHWs, technology, and local financing to build resilient, equitable systems from the ground up, making care truly affordable for everyone. The human cost of unaffordable healthcare is immense and unacceptable. It is measured in the children who die from easily treatable diseases, the mothers who do not survive childbirth for lack of a skilled attendant, and the families who lose everything they own to pay a medical bill. This is more than a failure of economics. It is a failure of empathy and a betrayal of our shared humanity. The story of Amina, forced to sell her family's future to save her child's life, is a reality we must refuse to accept. We have the knowledge, the resources, and the proven solutions to build a different world. Governments must make health a priority and move decisively toward universal coverage. Global institutions must back fair pricing and long-term system building. Change comes from the top and from the front lines and citizens who demand accountability. We must listen, stand in solidarity, and choose to close the gap, now.
Health is not a privilege. It's a fundamental human right, a core principle underpinning the concept of universal health coverage. Yet today, more than half of the world's population still lacks access to essential health services, facing significant and often insurmountable barriers. This global health gap is a complex issue, driven by pervasive poverty, challenging geographical isolation, and severely inadequate infrastructure. The dream of healthcare for all remains an unfinished journey, but it is certainly not an impossible goal to achieve. Disparities in healthcare access exist not only between different countries, but also profoundly within them, disproportionately affecting vulnerable populations. An inadequate health workforce and insufficient medical facilities further exacerbate this gap, leaving millions without necessary care. However, several nations offer valuable lessons in bridging this gap, demonstrating successful models of universal health coverage that we can learn from. Countries like Taiwan, with its universal national health insurance system, provide comprehensive coverage, short waiting times, and affordable costs for all citizens. South Korea blends public healthcare with private delivery, excelling in advanced technology, patient safety, and remarkably low costs. Australia's well-regarded system emphasizes preventative care, while Norway delivers high-quality healthcare through a strong public system funded by taxes. The United Kingdom's National Health Service, or NHS, is renowned worldwide for providing free healthcare to its residents and citizens at the point of use. A crucial strategy involves strengthening primary and community care, acting as the essential first point of contact for all healthcare needs. This includes vital services like vaccinations, comprehensive screenings, and the effective management of chronic diseases, all delivered close to home. Investing in these local services is key to reaching underserved populations and ensuring equitable access to essential health services for everyone. Technology also plays a vital role, profoundly transforming healthcare through innovations that enhance access and efficiency. Telemedicine, for instance, enables remote consultations, diagnoses, and treatment, effectively expanding access for those in remote locations or with limited mobility. Artificial intelligence improves diagnostic accuracy and personalizes treatment plans, while wearable devices monitor health conditions in real time, providing valuable data. Even drones are being utilized to deliver essential medicines and supplies to remote and hard-to-reach areas, expanding access significantly. Electronic health records streamline patient data management, improving care coordination, and enhancing overall efficiency within the healthcare system. Global health initiatives are humanitarian efforts that raise and disperse funds for infectious diseases, immunizations, and strengthening health systems in developing countries. Recognizing that factors like education, income, and living conditions significantly impact health, addressing these social determinants is crucial for equitable outcomes. Achieving healthcare for all demands global solidarity and robust partnerships among governments, international organizations, NGOs, and the private sector. These collaborations are essential for mobilizing resources, sharing vital knowledge, and implementing effective strategies worldwide to build stronger health systems. Healthcare for all is not merely a dream. It is our shared responsibility, a collective commitment to human well-being and dignity. By working together with unwavering dedication and innovative solutions, we can truly make the promise of universal healthcare a reality for everyone. This ensures that every individual, regardless of their circumstances, has the opportunity to live a healthy and fulfilling life.
Hi there, I'm Miss Sarah. Well, I guess you could call me Peaceism. Yeah, peace works. Let me show you something important. See these people? They're all struggling with healthcare. It's tough out there. But what if I told you there's a way to change all this? Enter World Peace Development Holdings Limited. They've got this amazing idea called the Peaceism Ecosystem. It's all about bringing people together, you know? Healthcare for everyone. Watch this. See how everything's connecting? Now look, people are healthier, happier, and more peaceful. Cool, right? Want to be part of this change? Join us at the Healthcare for All EXPO. Together, we're building a sustainable future. How's that for world peace? Remember, a healthy world is a peaceful world. See you soon.
Every single day, we navigate a world filled with choices that quietly shape our future health. These decisions are often so routine they feel automatic, like unseen currents pulling us in one direction or another. We decide whether to grab a piece of fruit or a sugary pastry for breakfast. We choose between taking the stairs or the elevator. We opt to stay up late watching one more episode or to turn in for a full night of rest. Each small choice contributes to a larger pattern, a cumulative effect. It can build a strong foundation for well-being or slowly erode our body's natural defenses. These risks aren't abstract, they are woven into modern life. Persistent stress from a demanding job, convenience of highly processed foods, sedentary office work, quality of the air we breathe, each plays a part. High salt intake may not feel immediate, but over years it leads to rising blood pressure. Gradual weight gain might seem cosmetic at first, but it's a major risk for type 2 diabetes. Chronic diseases develop slowly. That's why prevention is vital. Unlike an infectious disease that strikes suddenly, heart disease, cancer, diabetes, they come from countless daily choices and exposures. Care about these risks now, long before symptoms appear. Waiting till you feel sick is like waiting for the fire alarm when you can already smell smoke. By then, it's harder to manage. The real power is recognizing the smoke before the fire. We all face these risks, but that creates an opportunity. When we talk about health, our minds often jump to doctors, hospitals, and medicine, the tools we use to fight sickness once it has arrived. This is reactive care, an essential but incomplete picture. Preventive care, on the other hand, is a fundamentally different approach. It is not about treating illness. It is about actively creating and maintaining health to stop illness from ever taking root. Think of it as building a strong shield rather than sharpening a sword. While the sword is necessary for battle, the shield can prevent the battle from ever needing to be fought. This proactive mindset is the core of the prevention revolution. Preventive care is a broad and comprehensive strategy that rests on three main pillars: Education empowers individuals with the knowledge they need to make healthier choices every day. Early detection involves using screenings and regular checkups to find potential problems at their earliest, most treatable stages. Together, these pillars form a powerful defense against the onset of many common and debilitating chronic diseases. The advantages of prioritizing prevention over treatment are immense and multifaceted. First and foremost, prevention keeps people healthy and improves their quality of life. A person who avoids developing diabetes through diet and exercise is spared the daily burden of blood sugar monitoring, medication, and the risk of serious complications. Second, prevention is overwhelmingly more cost-effective. The financial toll of managing a chronic condition like advanced heart disease, surgeries, medications, and hospital stays can be astronomical for both individuals and the healthcare system. In contrast, the cost of a walking program or a community nutrition class is a small fraction of that expense. Ultimately, the focus on prevention represents a crucial shift in our entire healthcare philosophy. It moves us from a model that asks, "How can we treat this disease?" to one that asks, "How can we keep our community healthy?" This approach benefits everyone. Knowledge is the cornerstone of prevention. Without understanding what makes us sick and what keeps us well, it's nearly impossible to make informed health decisions. Education is our first and most powerful line of defense. It transforms passive patients into active participants in their own well-being. Clear, reliable, accessible information gives people confidence and capacity to act for themselves and their families. This is not a one-time event, but a continuous conversation that must happen in our homes, schools, clinics, communities. Simple health education can be profound. Remember the hand-washing campaigns, soap and water saving lives. Teaching about sugary drinks and obesity empowers parents to choose healthier options. Education on reading food labels, understanding portion sizes, recognizing signs of a stroke gives practical, everyday skills. Effective health education must be easy to understand and act upon. Complex jargon and dense pamphlets often fail. The best initiatives use plain language, relatable examples, visual aids. They meet people where they are. Local health fair, social media campaign, evening news segment, one-on-one with a trusted community health worker. The goal, health knowledge accessible to everyone. Many of the most serious health threats we face are masters of disguise. They develop silently, over many years, without producing any noticeable symptoms. High blood pressure is often called the silent killer. It can damage arteries and organs long before a person feels anything is wrong. Initial stages of certain cancers, high cholesterol, type 2 diabetes. This is why early detection is such a critical component of preventive care. It is our way of seeing the invisible, pulling back the curtain to find problems when they are small and easier to manage or cure. Screening tests are the primary tools for early detection. These are simple procedures performed on people with no symptoms. A routine blood pressure check at a pharmacy or clinic, a mammogram to screen for breast cancer, a colonoscopy to find precancerous polyps, a simple blood test to check cholesterol and glucose levels. The goal is to catch abnormalities at the earliest possible moment, not to diagnose full-blown illness. Finding and removing a small polyp can prevent colon cancer from ever developing. True health is not achieved through short-term diets or temporary bursts of motivation. It is the result of consistent, positive habits woven into the fabric of our daily lives. This is sustainable wellness. It moves beyond the quick-fix mentality and focuses on small, manageable changes maintained for years, even decades. A crash diet might give rapid weight loss, but it's rarely sustainable. Weight often comes back. In contrast, a brisk walk after dinner kept up for a lifetime delivers cumulative benefits year after year. Creating lasting habits requires a shift in perspective. Don't see healthy living as restrictions or sacrifices. See it as self-care and empowerment. If you hate running, Don't force it. Maybe you love to dance, hike, or swim. Healthy diet isn't boring. Explore whole foods, fresh vegetables, fruits, lean proteins. Individual choices are powerful, but they do not happen in a vacuum, you know. The environments where we live, where we work, where we play. A person may know they should eat more fresh vegetables, but that knowledge is of little use if there are no grocery stores selling affordable produce in their neighborhood. A parent might want their child to play outside, but that is difficult if the local parks are unsafe or poorly maintained. Creating health is a team sport. Communities can build systems that make healthy choices easy, natural, and accessible for everyone. Cities can invest in safe bike lanes and well-lit sidewalks, encouraging walking and cycling. Schools can ensure meals are nutritious, setting children on a healthy path. Local clinics can partner with community centers to host free health education workshops, stress management, and healthy cooking, bringing vital information directly to the people who need it. Policy matters too, funding public health campaigns, smoking cessation, vaccination, zoning that attracts grocery stores to food deserts, employer wellness programs, and subsidies that make healthy foods more affordable. These create the infrastructure for healthier lives. The idea of preventing illness can feel overwhelming, but the path to a healthier life is paved with small, manageable steps. You do not need to overhaul your entire life overnight, right? By focusing on simple, consistent actions, you can significantly lower your risk for many common chronic diseases. Let us break down some everyday risks and the practical steps you can take to mitigate them. High blood pressure is a major risk for millions. Start by reducing salt in your diet. Eat fewer processed foods, put away the salt shaker. Add more movement to your day. You don't need to run a marathon. A brisk 30-minute walk most days makes a real difference. Or split it into 3 10-minute walks. Get your blood pressure checked regularly at a doctor's office, a local clinic, or a pharmacy. If it's high, work with a healthcare provider, sometimes with simple medication. Type 2 diabetes. Cut back on sugary drinks, white bread, packaged snacks. Choose vegetables, fruits, whole grains. Increase activity to help insulin work better. Ask about regular blood tests, especially with family risk. Catching prediabetes early lets you reverse the course. Protect your lungs. Don't smoke. Avoid secondhand smoke. If you smoke, seek help to quit. In poor air quality, watch air quality alerts. Wear a mask when pollution is high. Eating less salt, walking more, quitting smoking. Concrete, achievable steps. These are the building blocks of a strong preventive health strategy that puts you in the driver's seat. Conscious, informed choices steer us toward a healthier destination. Not fear or deprivation, empowerment. Agency to protect ourselves and loved ones, one small step at a time. The journey to health starts at the dinner table, on the sidewalk, in our daily routines. The true power of prevention is best seen not in statistics, but in the real-life stories of communities that have embraced it. Imagine a small rural town where rates of obesity and high blood pressure were on the rise. In response, a group of local leaders and concerned citizens decided to act. They started a simple community walking program with a designated meeting spot every morning. The town invested in repairing sidewalks, adding benches, and installing better lighting to make evening walks safer. Slowly, the culture shifted. What started with a dozen walkers grew to over 100. Neighbors connected, shared recipes, and organized hikes. A year later, screenings found decreases in average blood pressure and BMI among regular participants. This town did not wait for a crisis. It built a system of health from the ground up. In a low-income urban neighborhood, many residents were missing recommended cancer screenings. The clinic brought screenings to the community, partnering with churches and community centers for wellness weekends. They offered free BP checks, diabetes screenings, and information to schedule mammograms and colonoscopies. Trusted community health workers met people where they were, answering questions and easing fears. The response was incredible. Hundreds who had not seen a doctor in years came to get checked. Several cases of early-stage cancer and prediabetes were discovered, allowing prompt treatment and prevention of more serious illness. This initiative succeeded because it removed barriers. It made the screenings free, convenient, and delivered by trusted messengers in familiar settings. It demonstrates a core principle of effective prevention: meeting people where they are, with the resources and support they truly need, creating a ripple effect of positive change throughout the entire community. The evidence is clear, and the message is hopeful. We have the power to shape a healthier future. The prevention revolution is not a distant, complicated dream. It is a practical and achievable goal built on the foundation of small, collective actions. It is about shifting our focus from simply treating disease to actively promoting a culture of wellness in our homes, our workplaces, and our communities. This journey begins not with a grand gesture, but with a single, simple step. The responsibility and the opportunity belong to each and every one of us, and the time to act is now. Start with your own life. Today, make one small change. Choose the stairs. Add a serving of vegetables. Go to bed 30 minutes earlier. Next, schedule that routine health checkup you have been putting off. Ask about key screenings for your age and risk profile, blood pressure, cholesterol, and relevant cancer screenings. Knowledge is power. Build support around you. Cook together, start a walking group, and advocate for healthier neighborhoods. We can choose a better, wiser path, the path of prevention.
For far too long, we have operated under a flawed assumption. We have treated the mind and the body as two separate, unrelated entities. We visit one doctor for a persistent cough, and another, if we dare, for a persistent feeling of sadness. This division is not rooted in human biology, but in the history of our health systems. It is an artificial divide that has created profound barriers to receiving good, compassionate care. It forces people to navigate a fragmented system, often at a time when they feel most vulnerable. This separation is inefficient, and it is failing millions of people around the world every single day. The truth is that our health is a single, interconnected state of being. You cannot be truly physically well if you are not mentally well, and vice versa. It means bringing mental health care into the spaces where people already go for their physical health needs, like primary care clinics, community health centers. It means treating the whole person, not just a collection of symptoms. This approach makes care more accessible, more effective, and deeply respectful of the human experience. It is the future of medicine. Imagine a world where discussing your mood with your family doctor is as normal as checking your blood pressure. This is the promise of integrated care. When mental health support is woven into the fabric of routine health care, it becomes just another part of staying healthy. This normalization is crucial because it helps people get help sooner, before a small problem becomes a crisis. It acknowledges the undeniable reality that our emotional well-being is fundamental to our overall health. Therefore, our mission must be to dismantle this artificial wall between mind and body. The cost of inaction is too high, measured in prolonged suffering, worsened chronic diseases, and lives diminished by preventable distress. By embracing a model of integrated care, we are not just redesigning health services. We are promoting a more humane and effective way of caring for one another. This shift is not a distant dream, but a practical and achievable goal. It begins with the understanding that mental health is not a luxury, but a fundamental component of all healthcare, for all people, everywhere. Our bodies and minds are in constant conversation. This is not a philosophical concept. It is a biological reality. Think about a time you felt intense stress or anxiety. You might have experienced a racing heart, a knot in your stomach, a tension headache. These are not imaginary symptoms. They are physical manifestations of your emotional state. The brain, through a complex network of hormones and nerve signals, directly influences the functioning of every organ in your body. When the mind is under prolonged distress, the body bears the burden, often in silent and destructive ways. Consider the impact of chronic stress. When we are consistently worried or overwhelmed, our bodies are flooded with hormones like cortisol. In the short term, this response helps us manage threats. But over weeks, months, and years, elevated cortisol can weaken the immune system, making us more susceptible to infections. It can raise blood pressure, increasing the risk of heart disease, stroke. It can disrupt our digestion, leading to issues like irritable bowel syndrome. This cascade of physical consequences shows that ignoring our mental health is a direct threat to our physical health. The connection flows in the other direction as well. Living with a chronic physical illness such as diabetes, arthritis, or cancer is an immense psychological challenge. The daily management of symptoms, the uncertainty about the future, and the physical pain can understandably lead to feelings of sadness, anxiety, or hopelessness. It is no surprise that people with long-term health conditions have a much higher rate of depression than the general population. When this depression goes untreated, it can make it harder to manage the physical illness, creating a vicious cycle of declining health. This intimate link means that we cannot effectively treat one without considering the other. A doctor trying to help a patient control their high blood pressure will have limited success if the patient's untreated anxiety is keeping their stress hormones elevated. Similarly, a person struggling with depression may find it difficult to muster the energy to exercise or eat nutritious food, further impacting their physical well-being. Recognizing this two-way street is the first and most critical step toward providing care that truly heals the whole person, mind and body together. Many people arrive at a primary care clinic with physical complaints that are difficult to explain. Persistent fatigue that sleep does not fix, vague aches and pains that move around the body, stubborn digestive issues with no clear cause. Doctors may run a series of tests, blood work, scans, examinations, only to find that everything appears normal. This can be frustrating for both the patient and the provider. Often, these mysterious physical symptoms are the body's way of expressing emotional distress. A person who is not comfortable saying, "I feel deeply sad," might instead say, "I am tired all the time." Someone grappling with anxiety might describe a constant feeling of being unwell or having a racing heart. In many cultures, it is more acceptable to talk about a physical ailment than an emotional one. The body becomes the voice for a mind that is struggling to speak. Stigma is one of the most powerful and destructive forces in healthcare. It is the shadow of shame, fear, and misunderstanding that surrounds mental illness. This shadow creates a wall of silence, preventing countless people from seeking the help they need and deserve. People worry about being judged by their family, friends, or co-workers. They fear being labeled as weak, crazy, or unstable. In many communities, these labels can lead to social rejection, discrimination in housing and employment, and a profound sense of isolation. The impact of stigma is devastatingly practical. People suffer in silence, hide postpartum depression, or delay help for years. Systems can reinforce stigma when services are far away or hidden, with long waits and daunting referrals. Integrated care is a powerful antidote. When mental health pros are part of the primary care team and doctors routinely ask about well-being, it sends the message that mental health is simply health. Integrated care is not a single, rigid formula. It is a flexible approach that can be adapted to different settings and resources. One of the most effective and widely studied models is the collaborative care model. In this setup, a primary care team, a doctor and nurse, works hand in hand with a behavioral health care manager and a consulting psychiatrist. The care manager, often a social worker or psychologist, meets with patients in the clinic, provides brief counseling, and tracks progress with simple tools. They consult regularly with the psychiatrist to adjust the plan, in close communication with the primary care doctor. Another approach embeds support in community settings, where people live, work, and gather. Trusted workers provide psychological first aid, teach basic coping skills, and connect people to more specialized care. Digital stepped care offers scalable first steps, guided apps, online programs, brief phone support, with step-up pathways to therapy or intensive care as needed. The common thread among these models is teamwork and communication. They break down the silos that have traditionally kept physical and mental health providers apart. Information is shared, care plans are coordinated, and the patient is always at the center. The goal is a no-wrong door system, where any entry leads to identifying and addressing both physical and mental health needs. This coordinated, team-based approach is the blueprint for a more effective, efficient, and compassionate system of care for all. While systemic change is crucial, there are powerful steps you can take to begin integrating your own mind-body care. Start the conversation. Next visit, be prepared to talk about your whole health. Reflect on emotions, sleep, energy, and mood. Choose one trusted health worker and share it. Simply saying, "I've been feeling very stressed lately," can be the key that unlocks better care. Second, build a personal toolkit for managing stress and improving emotional well-being. These do not need to be complicated or time-consuming. Start with deep breathing 5 minutes daily. Inhale 4, hold 4, exhale 6. This simple exercise can calm your nervous system. Visual. Simple infographic. Deep breathing, regular sleep schedule, talking to a friend, going for a short walk. Focus on a regular sleep routine. Consistent bed and wake times. Small, consistent habits beat big, sporadic efforts. Third, do not underestimate connection. Stigma thrives in isolation, and connection is its natural enemy. Seek a support group in your community or a moderated online forum. Sharing your story reduces shame and loneliness. Finally, be proactive in health planning, especially with chronic illness. Ask your team to include mental health support. By advocating for whole-person care, you improve outcomes and help educate providers about integration. For health systems and providers, the journey toward integration can begin with small, manageable steps that have an outsized impact. First, invest in training for primary care teams, nurses, community health workers, doctors. They do not need to become psychiatrists. Equip them with short, practical training to screen common conditions and ask compassionate questions. Teach brief, evidence-based psychological interventions. Second, add a dedicated mental health worker on site. Warm handoffs, brief therapy, coping skills, and regular follow-up transform access and reduce stigma. Third, use simple screening tools systematically, 2 or 9 questions, integrated into the electronic record to track progress over time. Finally, build clear, fast, supportive referral pathways with local partners, shared records, and dedicated lines so patients feel supported end to end. To understand the real-world impact of integrated care, consider the story of Maria. She's 54, living with type 2 diabetes for nearly a decade. She kept up with clinic visits, but blood sugar stayed high. She felt profound exhaustion and overwhelming demands of monitoring food, checking blood, and taking medication. A quiet sadness settled in. During a routine checkup, Sarah tried a different approach. After reviewing logs, she asked, "Maria, I know managing diabetes is a lot of work. Beyond the numbers, how have you been feeling in yourself lately?" Maria hesitated, then shared poor sleep, lost interest in hobbies, and feeling hopeless, believing it was weakness. Because the clinic used integrated care, Sarah reframed it as a health issue and introduced David, who met Maria the same day, taught a simple breathing technique. Over 3 months, 4 brief follow-ups and small goals, daily walks, reconnecting, while the team coordinated care. Maria's mood lifted, diabetes got easier, and readings improved. She later said, "For the first time, I felt like someone saw all of me, not just my disease." The evidence is clear. The moral imperative is undeniable. The time has come to end the false separation of mental and physical health. Integrating care is not radical. It is practical, humane, and cost-effective. Our minds and bodies are one. Earlier detection, improved outcomes for chronic diseases, reduced stigma, greater patient satisfaction, more sustainable health systems. This does not require an overnight overhaul. Small, deliberate actions build momentum. 1 clinic pilot, 1 university adding training, 1 community leader championing awareness. A story that can be shared, a model that can be replicated, a source of inspiration for others. Movements are built step by practical step, from the ground up. The path forward requires a shared commitment from all of us. If you are seeking care, be brave. Start a conversation about your emotional well-being. Ask for the whole person care you deserve. If you are a provider, be a champion. Learn 1 skill. Try 1 screening tool. Advocate for adding a counselor. Together, we can build systems that are smarter and kinder. No one should suffer in silence. Seeking help for emotional distress should be as normal as getting a cast for a broken arm. Let's commit to taking 1 action this week. Talk to 1 person. Share 1 story. Start 1 new practice. Let's begin bridging the divide and building a future where every person receives whole, compassionate care and can truly thrive. This is integrated care. You are not alone.